We are so happy that you've chosen Asante for your delivery. Here at Asante, we're always improving the way we care for newborns who've been exposed to drugs and medications in utero. In this tour video, you will see the areas of Asante Rogue Regional Medical Center that are used to care for newborns and their families. And you will hear from some of our team members who are providing this care. Let's begin in the Family Birth Center.
What will happen when my baby is born?
When a baby is born, we will place the baby right up onto your chest, what we call skin to skin, or up to your abdomen, but limit all of our medical interventions as long as we possibly can. Our goal is at least an hour of just being right up there with that mom on that chest, and breastfeeding can begin then without us even ever taking that baby off that mom. And what that does is that regulates the baby's heart rate, the breathing, the blood sugar. It helps the baby get all of those important first steps of life.
How do I know if my baby will withdraw?
We don't know until the baby is born whether or not they're going to have problems with withdrawal. What we do know is that if they're exposed to an opioid, they are definitely at risk for withdrawal. Most risk happens when it happens throughout the pregnancy. And that's why we really like to know if you've taken any opioids during your pregnancy, and especially when it is.
I've heard that heroin is an opioid. What are other opioids?
The common ones we think of are Percocet and Vicodin. We also have to worry about methadone and Suboxone and Subutex. So if you're unclear, it's a good question to ask your doctor of whether or not this is an opioid that you're taking.
What about the medication my doctor gave me for pain?
Unfortunately, we do have to worry about when moms are prescribed pain medications with their babies. They're still going to be exposed to the opioid, and so they can still have the complications of having withdrawal. So if you are in pain during your pregnancy, it's best to really talk with your OB provider about what other options there might be instead of medications.
Why are we focusing on opioids?
We focus on opioids because the withdrawal period for opioids is longer than with other medications. And because of that, we need to really monitor babies for a longer period.
When would my baby start to show withdrawal symptoms?
Babies, when they withdraw, it can happen right away, although that's fairly rare, but it can happen within the first 24 hours. But depending on what opioid you took, it can actually take up to 3 or 5 days. And so that is why we like to monitor these babies a little bit longer to make sure that they're not having opioid withdrawal symptoms as late as 5 days.
How will the monitoring period work during my hospital stay?
Sometimes when a baby is withdrawing, the baby needs to stay in the hospital longer than the mom does. So we usually make accommodations so that the mom can stay with the baby. If we don't have a room available, then we might move them to a room in pediatrics, or we might move them to a room up in the special care nursery.
What will the withdrawal symptoms look like in my baby?
Those symptoms vary. You can have difficulty eating, which is really important for a baby. So they can either vomit, they cannot eat well, they're not very coordinated. They can want to eat more than other babies. They can also have symptoms of having tremors or startling really easily. They tend to be more fussy than other babies. And it's hard because babies can't tell us why they're fussy, right? They can also have diarrhea, and they can even have fever caused by the opioid.
That sounds like a lot of symptoms. What should I focus on to know my baby's okay?
We want to focus on whether or not they're eating well, whether or not they're consolable, and whether or not they're sleeping. Those are really the big things that babies do.
If my baby has withdrawal symptoms, what can be done to help them?
What we like to do with babies that we know have been exposed to opioids is to really work on a low stimulation environment. So we like to have it really quiet. We like to feed them frequently. We like to have a lot of time with them next to their mom and dad or anybody skin to skin, because we know all of this makes them calmer and feel better.
How can I help support my baby through the withdrawal process?
You as the parents are the most important part in caring for your baby always, and particularly during this time if they're withdrawing. So there are many things that you can do to help soothe and comfort your baby. Those include things like unwrapping your baby and spending time skin to skin. You can breastfeed your baby if your medications allow, and keeping noise kind of low and muffled like it might be inside the uterus. Keeping bright lights more dimmed. And then another thing is that providing containment. So babies come out with, all of their extremities flexed like this, and so to kind of keep them in that comfortable and soothing position.
I've heard that a baby withdrawing might need morphine. How does that process work?
If your baby does need morphine, we would plan to give just as needed doses of morphine. They could definitely stay with you in your arms and get morphine and be skin to skin with you. We know that that's, in some ways, that's two types of treatment together.
Skin to skin care sounds important. How often should I plan to hold my baby that way?
If your baby is sleeping, you can provide skin to skin as much as you want. If a mom is sleepy, however, we like the baby to be moved over into the bassinet or into someone else's arms because we don't want you to risk falling asleep with your baby in bed with you. We do have volunteers who have been trained and screened who can come in and help you for a block of time with holding your baby.
A volunteer can provide support for a family by holding the baby when it's fussy or sleepy, if the family needs to take a nap, if they need to take a shower, if they need to get some food.
Can I breastfeed if I've been using opioids?
And we especially do encourage it, especially for moms that are taking long-acting opioids. So moms that are on methadone or Subutex or Suboxone, we really like to have them breastfeed. For some medications, we do occasionally have to hold off on breastfeeding, but we try our hardest to make sure that that is really needed because we know that breastfeeding is important for these babies.
Why is breastfeeding so important?
Breastfeeding is important for babies who are withdrawing because human milk is meant for human babies, and that mother's own breast milk is custom made for the needs of her baby. Lactation Services helps by providing one-to-one bedside support. We're here to answer questions. We help with positioning, we help with education, we help increase your comfort level and make you comfortable and confident in feeding your newborn.
What other support services will be involved in my care?
Our team is called the Pediatric Assessment and Therapy Services Team, and they call us the PATS team. So when your baby is here as an inpatient, we provide developmental care, which can include a developmental evaluation. We teach infant massage, and then we also have a developmental follow-up program.
Social workers become involved with all families that have babies that are experiencing withdrawal symptoms. So our role is truly to meet with you and assess what you need. So we're very non-threatening, and we really just want to make sure that your experience is positive and that you feel supported.
Thank you for choosing Asante. Our guiding values are excellence, service, teamwork, honesty, and respect. We look forward to offering all of this to you and your baby.